ఎస్కేప్ కొడితే ఇది కనిపిస్తుంది. ఓకే, లాస్ట్ లో ఎస్కేప్ కొట్టుకోవాలి. హలో, హాయ్. Good morning, everyone. Today I thought I'll discuss about common parental fears, anxieties, and questions, and what to do, and in which way a pediatric surgeon can support you. This is what I thought I'll discuss in this session, and this is very important period because commonly the moment a pediatric surgeon says your child requires a surgery, parents will have so many doubts, so many fears. So, who is going to take care of all of them? Because as a learned person and as a person dealing with all these things, we are the best people to tell you actually how to handle this situation and how to come out of it, and how we are going to literally handhold you and take you through this journey. And this is my standard statement. Actually, what I tell is a pediatric surgeon's work is just to fine tune little bit of God's unfinished work. God is creating all these human bodies, everything, and there will be little bit of mistakes which can happen in the process, and we are going to fine tune these things. So that is where a pediatric surgeon is born for, and it is our duty, and we are going to promise that actually we are going to successfully complete our duty very well. So pediatric surgeons can make it possible to take you through this journey. So, how to prepare a child for a surgeon? Actually, as a pediatric surgeon, what I am going to tell you, I am going to run through in the coming slides. So, it is from the first prize itself till literally the graduation, means till the adolescence. So, from newborn period to adolescent period, pediatric surgeons tackle these babies, and in the process, actually, we'll be tackling the parents and the grandparents and the families also, and we'll try to give the best possible successful outcomes to these babies. So, and safe surgery for every child is a pediatric surgeon's promise, and this is our theme for this pediatric surgery week in this 2025. So the moment I tell actually, yes, your child requires surgery, first of all, actually, parents will not be ready to accept it. And then slowly they'll start accepting it. Then they'll think actually, okay, if my child needs surgery, what should be done? So then they'll come to a reconciliation, and then they'll approach us in the second visit, and then we'll start talking up and what to do for this surgery. So this is a very brief, transient, very crucial period where all the parents actually they don't know what to do, and they'll be in so much of stress. In fact, this is the time when most of the parents actually they'll be thinking about going for a second opinion or second doctor, and they'll be running around the doctors thinking that who can give as answer, no, your child doesn't require a surgery. But truly speaking, a pediatric surgeon is telling actually your child requires surgery means he or she requires a surgery. So before putting a knife on the child, actually a pediatric surgeon thinks twice, and then only he'll be telling yes, he may require surgery. But when he says actually surgery is required, he's very confident that he's going to give you the best possible outcome for the baby. So parent safety, patient safety, and quality improvement. This is something every hospital and every pediatric surgeon will be doing in the patient care that he'll be taking care of. So there'll be definitely so much of communication gaps. So you might be thinking something different, and I might be talking something different. Yes, you did not understand. That is when a parent should open up and ask, doctor, actually, what should I do? What I did not understand this point again. So truly speaking, in my consultation chamber, I'll be spending around 30 minutes with each and every patient. In that, around 10 minutes, I'll be taking exclusively to make the child comfortable with me, because unless the child is comfortable, he'll never open up. So for him to be ready, we have to spend really so much of time, and we have to stoop to his level and understand what his feelings are. And unfortunately or fortunately, and we are very well versed with this, but a child of 1 year old is different, 2 years old is different, 5 years old is different, 10 years old is different, 15 years old kids are totally different. And of course, actually, as teachers might be there facing, uh, tackling a adolescent kid is still more difficult because the way he thinks is different and he'll never open up actually whatever I try to do it. So it is very difficult, yes. But even then, for him, actually, we should be talking about something like a cricket or something like that. So that is when maybe he'll be ready to open up. And but nowadays these Gen Z kids are actually so famous. But the moment I utter a word, and there some kids they'll be googling and they'll be checking what I'm talking about. So I should be very careful in talking to these type of kids, and usually we'll be successful in managing these kids and the families as well. So this communication gap should not be there between the family and the doctor. And for every surgery, actually, we have a surgery checklist, and we'll be preparing. Actually, anesthetist will be signing the checklist, and I'll be signing it off. And then actually, a nursing team which is involved in this surgery care, actually, they'll also be taking care of all these things. And whether all these programs are there, all this equipment, whatever, is it the right patient or not, and are we doing the right side or not? Actually, all these things actually will be discussed in before itself, and we have a specific checklist for that that should be signed before taking the patient inside and before the consent is signed. And most important is in an operation is infection. So operations usually pediatric surgeon deals with are very clean surgeries. They're elective operations. So in that there should not be any operation or infection in this. So that's why pre- before itself actually we'll be saying that actually if the child has got some infection or not. If at all, if the child has got infection, we'll cancel the infection, uh, cancel the operation, and then treat the infection, and then only we'll plan for the operation in a elective way in a right appropriate time. So while operating also we'll be giving a prophylactic antibiotic, and later actually after 6 hours we'll be repeating. Suppose if the operation is getting delayed, we'll be repeating the antibiotic as and when necessary. And according to the organ specific, we will be giving antibiotics, and then we'll be taking care of the kid. For example, means something related to the gut intestines, we'll be giving gut organism specific antibiotic. So it is not like randomly we'll give an antibiotic for everyone and same antibiotic for everyone. We have to choose. So dealing with the kid is totally different, and he needs a special care, and we are expertized in that, and we'll try to give the best surgical options. And so, first of all, a parent should understand why the surgery is needed. Is it really needed? Is this the time? And what will happen if I don't get this operation at this time? So, this we will explain in detail, and then only after the parent is convinced, actually, then that's the reason why actually we try to do these things in 2 or 3 sessions. So, frankly speaking, a patient, whenever is planned for surgery, he won't come for surgery immediately. Maybe he'll be coming for one more visit, one more visit. Only then, after he's convinced, after he understands thoroughly, after his family understands thoroughly, then he'll come to us for a surgery. And other thing is we discuss all the options which are available. So, for example, for some conditions, there are some non-operative managements also. So, for example, if it is a high interception, we'll do first a non-operative management, what we call it as a hydrostatic reduction, and then we'll talk about the laparoscopy, and then we'll talk about a open operation where actually a big cut will be there on the body. So it is purely the parent's choice what option to discuss and decide, and it is completely a parent's choice, and we leave it to the parent. When the parent is not able to decide, then actually as pediatric surgeon we'll try to involve, and then we'll tell actually for you this is the best, for your child this is the best. Same way in an operation also, we'll do open operations, laparoscopic operations, and robotic operations. And according to the child, according to the child's actually comfort, according to the child's convenience, and anesthesia feasibility, then we'll decide actually which suits the child the best. So a pediatric surgeon will try to give this, and he will guide you in all these things, and don't worry much about it. And we are there to help you. Coming to the surgery process and the recovery timeline, for some surgeries, the recovery is very fast. For some surgeries, it may take longer time. For those patients, actually, for example, a chest operation is being done. For those patients, actually, we'll be putting actually what is called as an ICD. For those patients, maybe they may have to stay in ICU for a longer time. Maybe they have to tolerate these tubes for a longer time. So we, as pediatric surgeons, we are very kind-hearted. Usually, we'll try to reduce the time of trouble for the child. So we don't go exactly by textbook thing about that this should be there for this many days. So we'll see according to the child comfort, and then we'll decide. Sometimes actually we'll try to remove tubes as early as possible, something like a urinary pipe or a pipe in the nose or pipe in the chest or in the abdomen. So all these pipes actually we'll try to remove as early as possible and retain them only for the time period which is required. As I told, pediatric surgeons are so soft and kind-hearted people, and they love kids a lot. So, and in the same way, duration of the hospital also. Actually, for example, actually adult patient, usually actually they'll be comfortable staying in the hospital for 5 days or 1 week. But we know as pediatric surgeons that a kid is more comfortable at home in this environment and with his family members, with his supports, with his peers, with his siblings. That's why we tend to send the babies as and when, as early as possible, whenever it is possible and feasible. So, talking to kid about surgery, be it by a pediatric surgeon, be it by a parent. It's totally different. It's not like actually for an adult you can tell, uh, uh, look, you are going to go for the surgery. This surgery will have this much of benefit, so we are going for the surgery. Maybe an adult can understand because it is his necessity. But as a child, for him, he doesn't understand first of all, and he doesn't know what is surgery. He doesn't know why the surgery is planned on him, and he doesn't know what a doctor is going to do and how things are going to be in the hospital environment. Because in our OP consultation, the child is so comfortable. He doesn't know what is going to happen because he'll be continuously playful, playing with his toys, and then he's so happy during our consultation time. But later on the day of operation, he understands that scenario is not the same as it was in the outpatient department of Dr. Nagendhar or some other pediatric surgeon. So it is not like that. So that is when actually patient will start getting his own doubts. So that's why little bit of preparation from parental side or from the pediatric surgeon side helps the child in coping with these situations in a very comfortable manner and easy manner. So this again, actually, I'm telling pediatric surgeon will be dealing with ages from newborn to teenagers. So during these times, actually, the manage coping with these children is totally different. So a child of 1 year old, yes, maybe he doesn't require much except for the mother's cuddling. But beyond 1 year of age, yes, he needs so much of understanding, caring, caressing, everything is required. So these things a mother can do very well, and father will be supporting the mother and the child very well. And in this process, actually, a pediatric surgeon will be helping them. So, first of all, actually, a child should understand why this child surgery is required. So, he knows what is the problem. So, as a good teacher, a parent, or as a doctor, actually, we should be telling him why this surgery is required, and if not, what is going to happen, and how he is going to get affected because of the surgery. So, once he understands this, he'll open up a little bit. He'll be ready to understand what we are trying to tell, and every child will have his own type of fears. So we as parents or actually as a pediatric surgeon, we should be helping him in getting him uh, out of these fears because that is very important. Actually, for the child to enter into the operation theater and go under a surgeon's knife, he should have the confidence in the surgeon and confidence in the system that nothing bad is going to happen to them. We are not going to hurt them too much. So that's why most of the anesthesias actually will be giving with little bit of sedation, and after the sedation only we'll be taking care. till that time, actually, usually the parents are allowed to be there with the kid, and then uh, they we need actually, of course, actually a pediatric surgeon also requires a parent support. So that's why we take the help of parent and the pediatric surgeon. Together we are going to give comfort to the child. So, but good part with the kids is they cope with surgery and the procedure very well. It's not he's not like an adult. Adult requires so much of pampering and all, and even from the family side also, actually he'll be totally different. Adult spheres are also totally different, and we can't underestimate them. But kids are totally different. But once he gets to know that actually this is a safe environment, no one is going to harm the child, he will open up comfortably and completely. And because a pediatric surgeon is a known face, usually we'll be traveling along with the child inside the operation theater as well. And till the anesthesia is given, actually we'll be there with his set of toys, of course. And with all these things, actually the kids manage and cope with the surgery better than most of the adults. And after surgery also, I'm going to tell in the coming slides, actually, after surgery also, the child is the best patient. So, because he knows what is going to happen, and because we give actually the maximum pain relief, and he'll understand, he'll cooperate, and he'll be nice to us actually throughout this journey. And if the child, either mother or the father, are anxious and nervous, child will often reflect these feelings and behaviors as well. So for this reason, actually, I always tell all the parents, telling that even if you are scared, don't cry in front of the child. Don't show your anxiety in front of the child. And a mother's confidence is a child's confidence. So a mother should be very confident, and she should continuously keep on smiling, and she should keep on boosting the child that yes, actually everything is going to be fine. I'm there with you. Our pediatric surgeon, Dr. Yonan, is there with you. Means in that way, child will feel very comfortable in a cozy environment, comfortable environment where he is used to. And this is very important. Family support is very, very, very important. And so that's why a parent needs to be educated well, and they should feel comfortable in this process. And any slightest doubt that they have, they should be asking the questions. And I often advise for a child of around something like 8, 9, 10, or adolescent age kids, these people are more curious in what doctor is talking also. So sometimes we'll involve them completely, sometimes we won't involve them completely. So whenever uh, uh, it is required, we'll try to divert the child's attention by sending him to some play area, or just to see some new things, or just to read some article. We'll give him literally a little bit of task to fulfill. During that time, we'll be taking the parents, and then we'll be talking about all the problems. So any surgery, for the matter of fact, it is not having any side effects or complications. So that's why actually whenever I'm going to talk about actually side effects or complications, I usually take the parents or grandparents or important people into confidence, and then I try to tell them when the child is not there. So there is some complications actually, good or bad, and they need little bit of clarification. These things actually will be doing it separately when the child is not there around, especially when he is in the uh, age when he is concentrating on the doctor or the parent. And sometimes actually where they'll be seeing the parent's face also. They'll tell actually, yes, my mother is nervous. Means maybe doctor is telling something. Actually, maybe their attention will be diverted completely towards us. So these are some important, simple things that actually every parent should be uh, putting their attention on, and then they will be trying to explain the child later, and if necessary, and involvement in decision making. Especially, I am talking about actually a child of I told actually 8, 9, 10 years old. Sometimes they'll be very curious. So then we will be teaching actually what is the problem, and what should be done, and how it should be done, and what if it is not done. So if the child can understand all these things, maybe he'll get some more confidence in us, and he'll be involved in the decision making, and then he'll be accepting the problem. And unfortunately, in this era, a child also needs to be taken into confidence, and he also needs we also need his consent. It's not an official less than 18 years, that not that type of consent. Like child should come wholeheartedly to you for coming for surgery. So this is where the family counseling together actually makes some difference. So there are several benefits of family counseling, and most important is actually communication will be there. The tensions and doubts will be reduced, and we have to show the empathy and something like actually those some people are strong-hearted, some people are weak-hearted. These weak-hearted people need little bit more empathy than a regular family member, and their emotional bonds are the ones actually which are going to help them in managing each other's. Means, for example, if I am conversing with a mother or a father, if father is mentally weak, actually a mother will be supporting. Literally, she'll be helping the pediatric surgeon in convincing the parent. So, uh, in this preparation, actually, a family counseling plays a really big role, and pediatric surgeon will be taking you through this journey. So, Kim's Cuddles, our family support, and our family counseling, we have a separate wing which is going to take care of your counseling. And we offer counseling sessions, many sessions in fact, and till you are convinced, actually, we are ready to open up and we are ready to clear all your doubts. So sometimes actually their language is totally different. They don't know English at all. They don't know Hindi at all. They don't know Telugu at all. So we'll try to coordinate according to the language of the family, and then we'll try to come to understanding, and then we'll try to teach the family what to do, what not to do, what are their doubts, how we are going to help them. And kids should feel comfortable in the outpatient period and in the operation theater, preoperative area, and postoperative area. That's why in few of our places, actually, we'll have actually a dedicated place exclusively for the children. So the curtains will be different, the posters will be different. The in bed, actually, we will be providing some toys as well, age appropriate, so that the child should feel comfortable. He should feel as if he has come for a vacation, not for a surgery. And we should take the kid through this journey in a very comfortable and pleasant manner. So sometimes many counselings will be required, and to increase the family's confidence, actually, we'll be doing as many sessions as possible. And in this bargain, some home modifications are also necessary. Something like actually kid after operation, he cannot continue to have his own traumatic environment around. Something like some sharps and all, they should not be there, and environment should be kept safe. So usually, girl and a boy in the same house. A boy might be very inquisitive about what is happening. He'll be very interested. He may be plucking all these things. So sometimes, actually, unfortunately, to tell, there are some behavioral attitude kids in the families. So if at all, if one child is getting operated, and if that attitude child is there, that child also requires some family counseling and family support, and little bit of counseling and preparation of that child as well. So all these things should be kept in the mind, and that's why a strong support system is required in taking care of these babies, especially when they are going for surgery. So one other thing actually a parent will have is my insurance applicable? And do we have an option of a medical loan? Because right now I don't have that much of money. And this is when our financial counseling team is going to help them. And we have a separate team, and they'll be taking care through this journey. And then they'll be dealing with all these problems. Because a pediatric surgeon, pediatric a child who is having a problem, that is when actually just then actually that family got married. Just then the family had this baby, and so to this surprise, and schools, to this surprise, if they have a problem of an operation and financial burden, sometimes they may not be able to take. So that is when actually they should be able to take the assistance from our team, and they are going to tell you about actually your policy, what is core problems in the policy, and what are all the things, and how to get a pre-authorization, and how the network hospitals actually will be, whether this hospital comes under that network hospital. That's why I'm Yogna with the pediatric surgeon working in Kim's Girls hospitals. We have three hospitals actually together, and coming forth, few more are coming. So if at all, if your insurance is not applicable in this branch, maybe I'll send you to a different branch. So you want, this way actually we are going to give the parent the best possible comfort and in this journey of the child going into the surgery. So once the pre-authorization done, insurance actually all whatever financial adjustments are done. So then the real day comes actually the or the previous day. So is my child comfortable? So what are the precautions I should take? What can I feed my child and what not to feed? So all these things we are going to do in our sessions, and then we're going to give you a detailed pamphlet actually which will tell about all these problems. So most important thing is during an operation, the child is given a full body anesthesia. So when the full body anesthesia is given, the child's stomach should be empty. So that's why this precaution is very important. So that's why 4 hours before and 4 hours after, we expect the child's tummy to be completely empty. So we don't want them to give any food or liquids. So for solids, yes, we tell 6 hours because solids stay in the stomach for a longer time. So when we give a body a full body anesthesia, we don't want any regurgitation of the food coming and spoiling the lung, and which can lead to the threatening problem of pneumonia, and it can be life threatening as well. So empty stomach is very important, and many parents they'll ask actually, will my child tolerate this? That's why what we do is actually a few hours before itself we start IV fluids so that his hunger will be reduced to some extent. So similar way, post-operative period also, the dietary advice that we give for all the families, kids is empty stomach for some more time because child is still recovering from the anesthesia. So still he is drowsy. When the child is drowsy, his reflexes won't be that effective. So the food can spill into the lungs. We don't want that to happen at all. So that's why we try to tell them actually keep the stomach empty for some more time. All these things will be explained in detail clearly before your child is planned for surgery. And most important is in this orthodox families and all, so that should not be given, this dal should not be given, this curry should not be given, this should be avoided. So maybe it is a child's choice, child's favorite. So you cannot divide a child of having his pleasurable things. So that's why I always tell all the parents there are no diet restrictions at all. So diet restrictions will be given, and they will be telling clearly. Suppose if antibiotics are given and if too much of painkillers are given, then we'll tell them not to give too much of acid producing food. So in this way, we'll be taking you through this journey, and then we'll be guiding you adequately. And the child's comfort is our comfort, a family comfort. That's why we'll try to see that the child is very comfortable throughout his journey. And next question a parent will definitely ask is, should I restrict my child's activity? When for how long should I stop him from going for swimming, going for playing, going from playing cricket, all these things or trainings. So those things are the things that which are giving maximum comfort to the child. Child cooperated with you for a surgery, so try to give the best possible thing for the child. So I tell all my parents, parents, don't restrict his activity. He can do whatever he want. Luckily, in children, it is nothing to do with the activity. Only thing we'll try to tell the parent is actually try to avoid the trauma. By mistake, actually, means while playing, actually, so that's why a supervised play is more important than uh, restricting his activity. So he can do whatever nonsense he wants to do, and it is his birthright. Surgeon puts 100% effort to give the successful outcomes. So much of planning is done, and our experience is adding to it. Our expertise in handling a child is adding to this. So in all this journey, a surgeon puts 100% effort to give your child more than 100% result. So our team at Kim's Cuddles as a pediatric surgery team, I am Yognagin, the pediatric surgeon. We have Dr. Manisha Reddy, Dr. Avinash Reddy, Dr. Ashish managing Kim's Cuddles, Kondapur, Gachibowli, and Secunderabad branches together in a successful manner. I always tell actually two minds are better than one single mind. So a team effort actually definitely is going to give actually more result. Means 200%, almost like a 200% result will be promising. And we are doing successful open operations, laparoscopic operations, and robotic operations. And we are taking successfully all the families through this journey. And I appreciate for your hearing. And quality and ethical practice is the key for any doctor's practice. And as a doctor, as a Kim's Cuddles doctor, as a team member, I'm going to promise that actually we are trying to give you the best possible outcome. And we'll be available anytime as pediatric surgeon to give the pediatric surgical advice. In fact, actually, pediatric surgeons are the people actually who give their phone numbers to the families, because family may get a doubt in the middle of the night, suddenly the night before, suddenly the day after, day before, and that moment they want to communicate with us. That communication is very important. Yes, we are available for you anytime round the clock, because a family or a parent actually will not call just like that. Hi, Doctor Yona, did you eat the food? They'll never call like that. They are calling us because of so much of anguish in their heart, so much of stress in their heart, and tomorrow actually their child surgery is there. So how to tackle it? So all these things we'll be dealing with us, with you and with the families in a very detailed way, and we are there to help you through this journey of your child surgery to give the best possible outcome. And this is our promise as a pediatric surgical team at Kim's Cuddles. Here I have a doubt from one of the family member. Actually, they're telling, Doctor, any number of consultations, is it okay for us? So, as a good doctor, we are ready to open up and be ready for you any number of times. And your child is going to go for a surgery. It's a very big thing. And similar way, actually, I'll be feeling the same thing. We are there for you any number of times. One family member is telling, Doctor, do you mind if I call you? So that is the reason why, as a pediatric surgeon, we are giving you the phone number so that you should feel comfortable at any point of time. You can ask any number of doubts. So with this, we'll close the session.